Hello, everyone, and welcome to our LD40 webinar, Solutions for Gender-Inclusive Livestock Vaccine Systems. I'm Johanna Wong, the Monitoring and Learning Outreach Officer, and also the Gender Lead for SEBI Livestock, the facilitator of the Livestock for Decisions Network. Now, before we begin, I would like to advise everyone that this session is being recorded and will be publicly available on YouTube, livestockdata.org, and through the LD40 and ILRI Gender and Livestock Data Community of Practice online hub. If you would like to join our community of practice and continue this conversation online, please sign up via the link that Fiona is going to put in the chat shortly. And a very quick shout out to the COP co-facilitators, Alessandra Gallier, Beth Miller, Annie McLeod, and Fiona Allen, who will be either visibly or invisibly helping me out today. So for today's webinar, we're really happy to be partnering with Canada's International Development Research Centre to bring you 4 presentations from the Livestock Vaccine Innovation Fund projects, which aim to improve women's access to livestock vaccines. To introduce these projects, we have Evelyn Baraké, the Program Officer with IDRC's Climate Resilient Food Systems Program. Over to you, Evelyn.
Thank you so much, Joanna. It's a pleasure to be here, and thank you for all who've joined today. I'm just going to share my screen. Please give me the go-ahead when you see it full.
Yep, that's full screen now. Thanks, Evelyn.
All right, perfect. So it's a pleasure to be here and to have the opportunity to present, to introduce this webinar. So I'm a program officer with the Livestock Vaccine Innovation Fund at Canada's International Development Research Centre, as Joanna mentioned. And the Livestock Vaccine Innovation Fund is an initiative that's a partnership between IDRC, the Bill and Melinda Gates Foundation, and Global Affairs Canada that focuses on partnerships to develop vaccines that are affordable, available, and acceptable to livestock smallholders and to facilitate their use at scale, targeting especially the diseases that most affect women and men livestock smallholders in low and middle income countries. So as part of the initiative, we fund a number of projects that fall at different places on the innovation to uptake continuum. So the projects that we'll be speaking about today focus on access, affordability, and uptake with, of course, a gender lens. So a little bit of a backstory for why these projects are that we decided to support them. So back when the Livestock Vaccine Innovation Fund started off, IDRC commissioned a scoping study on the gender dimensions of livestock vaccines to understand where gender fits into livestock vaccine development, distribution, use, and training of vaccinators. And the key points that emerged was that in Southeast Asia and South Asia and Sub-Saharan Africa, women are, as I'm sure all of you know, generally responsible for the rearing of smaller, lower value, quote unquote, livestock, such as chicken, goats, and sheep. And many of their livestock die every year of vaccine-preventable diseases such as Peste des petits ruminants or CCPP in the case of small ruminants or Newcastle disease in the case of chickens. And their access and use of vaccines is constrained by many factors, one of them being, of course, knowledge. So not only is there, of course, educational disparities, but women are often not targeted by service providers, both public and private, who target the male head of household, who's considered the farmer, and women are often considered the helper. So information doesn't necessarily pass down to the women. And furthermore, these animal diseases are not necessarily prioritized by government campaigns or by veterinary services, who generally focus on the larger or higher value livestock. And then we also have the issue of lack of access to resources and decision-making power. So, of course, gender norms around men being the financial providers for the family dictate that in many cases, women are expected to ask permission to get their animals vaccinated or to request the funds to be able to do so. And then we also have time constraints or mobility constraints. As we know, women often have multiple overlapping roles in a household in terms of taking care of kids or sick relatives, doing food processing and food preparation activities, fetching water, fetching firewood. And this makes it difficult for women to access or to go to vaccination sites, for instance. And then you have systematic barriers at that last level that reinforce all the barriers that I've just mentioned. So there's few women in the veterinary or animal health services due to barriers to accessing and completing the educational requirements to get into those professions. And government campaigns and often focus on the larger commercial operations, which means that in some cases, like Newcastle disease, for instance, vaccines may only be imported and sold in high dose packages, which doesn't make it economical for smallholder farmers. And most women, as we know, are smallholder farmers. And you also have the issue of lack of cold chain, again, compounding all those issues that I've already mentioned. So that's a little bit of background on what we've discovered. So for that reason, we, as the Livestock Vaccine Innovation Fund, wanted to focus to support a set of projects that were specifically designed to address women's or to generate new evidence on how women can better benefit from vaccines and to better participate in the livestock vaccine value chain. So these projects support the empowerment of women as livestock farmers, as entrepreneurs, and as veterinary service providers along the livestock vaccine value chain for chicken and goats. So up on the screen, you can see the 4 projects that have been funded under this cohort. And what makes them really unique is that they are led by gender experts, really to avoid gender fade. We wanted gender to be front and center and an operational part of the research. And they also include systematic processes to integrate gender at every stage, a key element of which is participatory action research. And they have robust management frameworks to measure gender outcomes and impacts at the research project. And we also have those at the program level. So I'm sure that will be an interesting point of discussion in this webinar. And just quickly, I want to talk about the cohort approach. The benefit of funding these projects as a cohort and supporting them and having them start at the same time has led to a lot of cross-project collaboration and knowledge exchange, and also the opportunity for joint dissemination and sharing research, sharing evidence and lessons learned on using a common set of tools. So it's a really exciting cohort of projects that have generated some very interesting evidence. I'll leave it at that for the projects to share the results themselves. Thank you so much. Back over to you, Joanna.
Evelyn. Thank you so much. I'm really looking forward to hearing from our speakers after that overview. So I just wanted to check quickly, do we have Peter here? Peter, if you're here, if you can please speak up. Otherwise, I will share my screen here.
Hi, everyone. Peter will be here in about 2 minutes. He's trying to connect.
Okay, no worries. Maybe I will start introducing Peter. But just to let everyone know, the format of today's session, we will have 2 speakers and then a Q&A session for those 2 speakers, and then another 2 speakers and another Q&A. So for the first and the third presentations, please hold your questions or put them in the chat, and we will get to them after those 2 presentations. So while hopefully Peter will join us in a minute, but please let me introduce him. Awin Peter is a passionate CEO and the co-founder of Cowtribe, a tech social enterprise in Ghana. Cowtribe brings vital livestock vaccines to remote smallholder farmers. And by January 2023, Cowtribe had delivered 20 million vaccine doses across Ghana, significantly improving farmers' income and food security. Remarkably, 95% of these farmers were first-time vaccine users and 30% were women. And this really demonstrates Cowtribe's transformative impact and the commitment to gender equality. So Peter's pioneering work has been recognized by the government of Ghana and has earned him awards such as the Ashoka Fellowship for Social Entrepreneurs. He also holds a master's degree in international business from the University of Ghana. So, Peter, are you with us yet? As always,
Agnes is here.
Okay,
okay? Agnes has kindly agreed to speak instead of Peter, who's having a hard time joining Teams. Sorry about that.
No problems. Should we, Agnes, do you want to make a start?
Yes.
Yeah, okay, great. Well,
yes.
In that case, let me also introduce Agnes. Just give me one second. So Agnes Loriba is the team leader for Care International in Ghana's Food and Water Systems and Climate Change Program portfolio. She also serves as the co-interim head of programs for the country office. She is an all-round social development worker with over 14 years of extensive hands-on working experience in Ghana, 9 years of which have been served in senior program leadership and management. She holds a first degree in development studies and a master's degree in development management, both from the University for Development Studies in Ghana. Thank you for jumping in last minute, Agnes. I'll hand over to you.
Okay, yeah, so thank you and good morning to everyone. I think it's now even afternoon in Ghana. We can go to the next slide. Yes. So our project is titled Transforming the Vaccine Delivery System for Chicken and Goats in Ghana. So researching to really understand what it takes to have vaccines reach women, benefit women, and also benefit women who operate in this value chain as service providers. We started work in 2019. We are closing this year, and currently I'm here with Alexandra and Nelly because we are doing some endline studies with an extension we received. Our work is in the Upper East region of Ghana. I think from the map, we can all see the red shaded portions. Livestock is very important in these parts of the country because we have just about 6 to 7 months of rainfall, which can also be very variable. And so livestock comes in handy for resilience, for income, and all that. Our project is implemented by a team of 3 institutions, Care International, where I work, the International Livestock Research Institute. They lead on the research aspects of our work, and then Cowtribe Technology Company leads with vaccine delivery, quite heavy, tech heavy in that regard. So I think I have already highlighted the importance of livestock, but most especially chicken and goats for women's livelihoods in this part of the country. Access to vaccines limited due to structural issues such as gender norms that limit women's ability to take decisions about vaccinating their livestock, to reach animal health service providers as women, even to keep livestock, there are limitations that come in due to the existing norms, also limitations with mobility. All these affect women's ability to access, reduce mortality, have more productive livestock to support empowerment, and then also livelihoods. So our project, as I mentioned, has been researching to determine what it takes, what are the requirements. And to do this, we are working towards 4 key objectives. So we are testing 2 different gender approaches, a gender accommodative and gender transformative approach, and see how we are able to enhance women's access to vaccines through these different approaches, which works better. Also working on generating evidence to understand what are the institutional requirements, mechanisms we need to have in place at the institutional level to support a gender-responsive vaccine delivery system. Also understand what are the norms that we need to address, what capacity we need to build to have a gender-responsive vaccine delivery system. And also finally, we have been implementing also a scaling component of this, working to determine what is the effect of combining a technology and a social approach, in this case, a gender transformative approach. What does it take to combine these, and what's the effect is thereof? Next slide, please. Okay, so in terms of our methodology and what data we have been collecting at baseline, we started off with a WELI study to understand empowerment, to understand norms, to also understand livelihoods in these locations better. After that, we have built on implementing both the gender interventions for transformative and responsive interventions. And at end line now, we are repeating the empowerment study, also looking at norms and livelihoods. In terms of what data we've been generating, trying to understand what participation rates are, vaccine utilization, how this affects mortality, also customer satisfaction with vaccination. We are, again, on WELI, working on understanding women's access to and control over resources, decision-making at the household level, time burden, allocation, leadership roles, how these are changing over the course of implementation. Next slide. Okay, so in the interest of time, I will not go a lot in detail with the approaches, but here we are just outlining the key sets of interventions for the gender transformative and gender accommodative interventions. So the gender accommodative locations, we focused on raising awareness about the gender issues, ensuring that there's a vaccine delivery system that works, improving knowledge about husbandry practices, about the importance of vaccination. In the gender transformative villages, we had the gender accommodative interventions in addition to some in-depth work on understanding what the norms are, reflecting with communities to take action to address these norms, working with community leaders, both men and women, traditional leaders, spouses of the project participants, to address these norms and take specific action towards change. Next slide. Yeah, so in terms of key results, we have found through data we have generated both at midline using outcome mapping and now based on early results from our end lines. We see increased access in terms of vaccines. We are reaching 4,000 plus women with vaccines. 91%. Hello?
3 minutes, Agnes.
Okay, so satisfaction with vaccines, assets accumulation, increased income due to reduced mortality, more productive livestock, market access, also through use of technology, we are delivering vaccines more efficiently, and so reducing cost. We also see we have generated results in terms of norms, so understanding the norms and also changes that have occurred based on the, especially in gender transformative communities. We see women are able to keep livestock by themselves, are able to sell, are able to request and reach out to animal health service providers now by themselves as women. And so all these are connected to other economic indicators or variables that we see as in how they benefit from livestock. Next slide. So how are we using the data we have been generating on this project? So from our inception phase, we have used the data we generated for initial consultations with policymakers, with farmers, to also even inform our interventions. Same for midline data. So these results, especially assessing changes in behavior, have informed how we have adapted, especially the gender interventions and also for the technology aspects of this. So as we conclude the project, results from the data we are generating on these approaches have informed our engagements with government. We have had a policy engagement. We have a policy brief. We are also currently piloting integration of the approach through a government-led PPR vaccination campaign in 11 pilot districts in northern Ghana. Next slide. I think that should be next.
Okay, I think that's your last slide there.
Okay,
Agnes.
that's the last slide. Okay.
Thank you very much, Agnes. I'm just going to go back one slide because I find this really interesting, that the differences between in these social indicators between when you use a gender transformative approach compared to a gender accommodative approach. So there's a lot to unpick there for now, but we are going to move to our next presenter. So let me just bring the slides up and let me 1 second. Okay. So our next presenter is Nargiza Ludgate, who is an interdisciplinary social scientist at the University of Florida. Dr. Ludgate's background in development informs her research, most of which is applied and focused on food security and gender equality. She utilizes mixed methodologies and participatory approaches to explain complex issues that surround women's empowerment, social capital, and collective action. As well as gender-based violence, intersectionality, and the role of community-based organizations on women's leadership potential in patriarchal societies. For the last 12 years, she's worked on agriculture, water, extension, and livestock projects in Burkina Faso, Ethiopia, Jordan, Iraq, Nepal, Niger, Rwanda, Senegal, Tajikistan, and Uganda. Over to you, Nargiza.
Thank you very much. Hello, everybody. Thank you very much for this opportunity to share some of the findings from our project, Advancing Women's Participation in Livestock Vaccine Value Chains in Nepal, Senegal, and Uganda. And the data, the findings are based on the qualitative research, which was the major methods that we used in our project. Next slide, please. We conducted research in 3 countries, and we selected our research sites based on the importance of livestock keeping as key livelihood source, the prevalence of PPR disease, and in the case of Senegal, both PPR disease and Newcastle disease, and the existence of notable gender and social cultural dynamics. In Uganda, we worked in the northeast of the country in an area called Karamoja in 4 districts. Karamoja is home to the Karamojong ethnic groups such as G, Mateniko, Etur, and they also have other distinct ethnic groups such as the Peth and the Pokot. Agropastoralism is the main source of livelihood in the area. Men raise cattle and women tend goats and sheep and grow crops. These groups are geographically isolated from the rest of Uganda and have been historically marginalized, both politically and economically. In Nepal, we worked in 6 districts representing 2 agroecological zones, the hills and the Terai, the lowland. Many smallholders rear goats in mixed crop livestock systems, but these efforts are negatively affected by disease outbreaks, geographic isolation, and limited access to markets and transport. And they also have a conservative Hindu caste-based social system. Poor households tend to be lower caste, Dalits, and reside further away from the community centers and other resources. The higher caste groups, Brahmin and Chetri, tend to have more goats, more livestock, as well as they reside very close to the community centers and the resources. In Senegal, we worked in 3 departments of Kaffrine region. Many households here practice a mixed livestock crop farming, including cash crops and small ruminants. The Wolof population reside in the south and west and involved in mixed crop livestock farming. The north and east of Kafrin is more arid and geographically isolated, with Fulani being a dominant ethnic group engaged in herding cattle and small ruminants. Next, please. So the aim of our project was to increase women's knowledge and access to livestock vaccines. One of the key challenges we find working in the gender and livestock spaces is that we are not paying attention to intersectionality and how women's experiences differ, and their inclusion and marginalization are affected by different identities they have. Therefore, one of the key questions we asked was how intersectionality affects women's access to vaccines and their livelihoods, which depend on the good health of the goats, sheep, and poultry. We used mixed methods, but with greater emphasis on qualitative data collection using focus group discussions, individual interviews, key informants, but we also used survey tools at the baseline and end line. For example, we used the Women's Empowerment in Livestock Index, WELI, that Women Rear, Agnes just shared about, to measure changes in women's empowerment. We also looked at changes in knowledge, attitudes, and practices of both livestock keepers and animal health service providers. Next, please. Next, please. So in our research, we use different approaches. We started with the mapping of the actors and relationships in the vaccine delivery system using what we call gender intersectional transformative approach in order to identify the different identities of livestock keepers and that matter in each context. We interviewed and did discussions with livestock keepers, community animal health workers, and actors of the vaccine delivery system, such as vets, vaccine suppliers, vaccine regulators. We found that gender norms are rigid in the animal health space, more so than in other livestock domains. Women have very limited decision-making when it comes to animal health and vaccinations, but they are most affected by animal diseases and death. We also found that there are very few women among animal health service providers due to prejudices around women's physical strengths and knowledge. From intersectional analysis, we found that the most significant barriers for women livestock keepers in Nepal are gender, caste, and remoteness. In Uganda, gender, ethnicity, disability, age, and widowedness marginalize and exclude women. And in Senegal, these were gender, ethnicity, and remoteness. And so we had to pay attention to these differences as we went to the intervention phase. So the second thing we did was we designed a training intervention, keeping in mind the learnings from the mapping. Too often, projects design trainings for communities and animal health service providers without paying due attention to intersectionality. In our case, we developed a novel package of the three-tier training using GITA. We first trained 44 vets across 3 countries in soft skills such as gender, intersectionality, conflict mitigation, empathy, entrepreneurship. Then for the second tier, we engaged vets to cascade the training to 178 community livestock vaccinators. And the third tier, we conducted community sensitization for 3,600 women and men in partnership with community vaccinators and vets. Next, please.
3 minutes, Nargiza.
Mm-hmm. While our training materials for vets and community vaccinators were manuals and slides, the materials for communities were storytelling using illustrated flip books and posters. To communicate intersectional issues and norms around women access and engagement in vaccinations, we highlighted the differences among women. For example, we challenged social cultural myth around women being weak to handle livestock, goats, for example, compared to men in Senegal, that a woman from an untouchable Dalit caste having fewer goats and living far away from the center is as important to in the campaign to eradicate PPR disease, and that a menstruating Pokot woman can enter livestock corral as a G woman in Karamoja without spoiling the livestock. One more thing is that we intentionally engage community livestock keepers, community vaccinators in community sensitization activities to build trust and bond among women and animal health service providers, and to facilitate mindset change among vaccinators that women can be potential clients for their business. Next, please. Our focus on intersectionality and integrating learnings from Gita led to other shifts in mindset at different nodes of the livestock vaccine delivery system. Our findings show that 70% of animal health service providers reported integration of gender and intersectional considerations in service delivery. Community vaccinators started to deliver services to women from marginalized communities and who are far from roads, from animal health posts. At the community level, women started to access the livestock spaces, which are usually dominated by men. I have a few quotes, but I wanted to read one of them, and it's from a male vet from Nepal who said, "We send notice to everyone," meaning vaccinators, so they could come to Livestock Service Division office to collect vaccines. There were female vaccinators who came to collect vaccines. I was personally so glad that more female vaccinators were interested to work. I think vaccinating livestock is not an easy job, and there were married women also. And then finally, both women and men reported challenging gender norms and gender and social norms. For the sake of the time, I will move to the next slide. This slide are some of the insights for how we use the Gita in our approach to do research as well as to do our intervention, and what are the learnings from that. This summarizes what we've seen across all three countries and then specific to each country. Across countries, refresher trainings for soft skills for animal health service providers is a must. Because they are trained, some of the community animal health service community animal health workers only participate in one training in their life when they're getting a CAHU certificate. In Senegal, more efforts are needed. In Senegal, it is important to set up a system that recognizes and incentivizes community level animal health service providers like auxiliaries and relayees to offer animal health and vaccination. In Nepal, they have gender equality and social inclusion framework, but it has not been mainstreamed through the ministries and particularly in animal health delivery system. And in Uganda, more efforts needs to be to facilitate a joint work of vets with community development officers to ensure that people's skills, people considerations are integrated in technical solutions. Thank you. This is all.
Thank you very much, Nargiza. It's really nice to see intersectionality being explicitly considered and addressed during training and sensitization, and also very nice to hear the voice of the community come through in your quotes there. Those slides will be shared online, so people have plenty of time to peruse them. So I'm going to open the floor now for questions for both Women Rear. So I think Peter has joined us now. Welcome, Peter, and also Nargiza. And I see one actually from Zelalem in the chat. If anyone else has a question, please raise your hand. But the question is for Women Rear. The interventions seem to have brought about significant changes. Are there any comments on sustainability, particularly the technological interventions?
Yeah, thank you
Peter,
very
do
much.
you want to? Yeah, thanks.
Yeah, I'm so happy to join the conversation finally. Tech disappointed me. And just to go straight to the question, I think this is really a useful question because even when we started the implementation, we realized that we need to make it as low as possible for farmers to engage. And one of the things we realized was just how much requirement we needed from these farmers to be able to engage with our application, especially because it was a smartphone application, and most of the farmers had no education level to be able to operate that. So we quickly moved to what we call agent-assisted model, where we maintain agents within the communities to be able to order the vaccines on behalf of the farmers. That is one of the things. And the second one was we ensured that even with the phones that they had, the very low technology phones that they have, they can actually be able to make a call. And when those calls are received, we have customer service to be able to, make sure that whatever they needed were. So in terms of sustainability, I think one learning that we have is that we really don't need to push farmers or people within the rural communities to adopt technology, especially when it doesn't come at a pace that they can follow. But one of the key interventions is to use the agent-assisted model, especially if the agents are within the communities that they are in, and they can trust them to be able to make some requests for services on their behalf. That worked in our case, and we saw that as a very useful way of making sure it's sustainable.
Excellent, thank you. And I see in the chat there's been a question about whether farmers paid the market price, but I think that's been answered already, and that they did. Okay, anyone else have any questions from the audience? Alexia.
And I think there's a question about decision making.
Oh, I can't see it.
It was, excuse me.
It was
this is
there. No,
Beth. Yes, no, it was in a different format, but the question was if you could just speak to the significance of the change in women's decision making. Why is that when we compare the gender transformative with the gender accommodative approach, why is that so important? If you could speak to the people, especially who are doing livestock work, but may not have had much experience with thinking about gender and all of the dimensions that go into that.
Sorry,
Thank
Beth,
you,
who
Beth.
is that question? Yeah,
We
who is
have
that question
Nelly
to?
Giro
Okay.
from the team of Women Rear. She's been doing her work on exploring gender norms. She wants to answer. She's here.
Yeah, so thank you very much for that question. Yeah, so the impact of GTA on the women participants was quite evident from our headline data, where we see that increasingly women are taking decisions that deem appropriate and beneficial to them, rather than depend on their spouses for advice, especially when it regards to accessing vaccines, when it regards selling their animals. They can actually independently sell their animals. Of course, not entirely, not 100%, but increasingly this is happening. And then also when they want to call a vet, that is also happening without consultations with the spouses in the GTA community. And that has led to great control and autonomy over their own livestock. When we look at the data that we're getting from GAA community, we see that previously, women could not approach their spouses to ask them for permission to even call the vet or even sell their animals. But now, with the interventions that have taken place in the GAA community, women are increasingly able to confidently approach their spouses and request them to sell their animals for them, as well as call the vets for them. And so this was not happening in the past, and now it is happening, which is quite some great change. So we can see a lot of positive change in both GAA and GTA community, but more so in the GTA community. Thank you.
Thank you very much, Nelly. Alexia, you've got your hand up. Do you want to ask your question?
Oops, sorry. Thank you. I had a question for Nargiza about community animal health workers that were used in Senegal, Nepal, and Uganda. I believe, sorry, they do not benefit from the same legal status and recognition depending on the country. So I was wondering what was the feedback from the Senegal counterparts, for instance, because I know in Senegal it's a bit touchy, and I think in Nepal community animal health workers are recognized, and in Uganda they are only okay working in Karamoja. So I was again thinking about sustainability, and beyond the project, are these community animal health workers going to be able to continue working? Thank you.
Yeah, thank you, Alexia, for this question. It's very important. Across all three countries, the community animal health workers are not officially recognized. For example, in Karamoja, they have been they were brought on board to fill the gap for vets. For animal health care, and also because of the livelihood system they have, pastoralism, agropastoralism. But in Senegal, auxiliaries and relays and village animal health workers, that's how they call them in Nepal, are not part of, officially not part of the system. In Nepal, some work has started to get more training and certification and some type of recognition as business owner, vet entrepreneur that would legalize his status. But the question you ask is very good. So in Karamoja, we worked, in all three countries, we worked within the existing system or social structure for animal health service delivery. They are not recognized, but they are often engaged by vets to vaccinate, to mobilize communities for animal health campaigns, and so on. In my presentation, I didn't emphasize on the role of stakeholder engagement that we brought in, is where we, from day one, when we, as we started to map the livestock vaccine system delivery, we saw these issues right away, and also from the literature review. And in Uganda at the moment, there is a push there is work on standardizing the curriculum as well as the minimum standards for community animal health workers in Karamoja, because community animal health worker can work only in Karamoja. They do not exist anywhere else in Uganda. In Senegal, more needs to happen, but the ministry is interested to bring at least, especially the auxiliaries on board, because these are the women vaccinators and they're trained to vaccinate chicken. I hope this answered your question.
Yes, sure. Thank you. For professional interest, let's say, I'm very interested in the legal framework around community animal health workers. And I know from VSF member that in Senegal, there is a bit of pushback from the veterinary profession. So that's why I was asking. Yeah, thank you.
Thank you very much, Alexia. Oh, sorry, Nargiza.
Yeah, there is a comment that was just posted that in Karamoja, there is already a standardized curriculum developed by Mercy Corps and Makerere. There is, but it's still in the draft form. It's still going through the standardization and approval. And one of the contributions of our project is that we raised the importance of integrating soft skills, whether that's gender or intersectional considerations, conflict mitigation, particularly empathy, as the key components of that curriculum, because a lot of emphasis is technological or technical solution, but no one is paying enough attention to people's issues.
Thank you very much, Nargiza. We're going to move on now to our next two presenters. And first of all, we have Professor Salome Bukachi, who is an associate professor in the University of Nairobi's Institute of Anthropology, Gender and African Studies. She has a background in medical anthropology with a bias to infectious disease in the areas of community participation, gender, health systems, livestock farming, socioeconomic and behavioral studies, food safety and security, and water sanitation and health. Professor Bukachi serves as a member of the African Region EcoHealth Chapter, a member of the African One Health Network Steering Committee, and a member of the One Health High-Level Panel. Professor Bukachi has pre-recorded her session in case of connectivity issues, but she's also here live to take questions. So let me play you her presentation now.
Greetings, everyone. My name is Salome Bukachi, an associate professor in the Institute of Anthropology, Gender and African Studies of the University of Nairobi. I'm representing the GIVE project, which is one of the LVIF projects. Our project aim was titled Improving Gender Equality Through the Power of Collectives, the Case of Gender Inclusive Vaccine Ecosystem, acronymed GIVE, project in Makueni County. This brought in 3 different institutions: the Cooperative University of Kenya, Kenya Agricultural and Livestock Research Organization, and the University of Nairobi, of which I'm representing. So to give a background, Makueni County, where this study was carried out, is one of the arid and semi-arid areas in Kenya. And it's one of the places where the total chicken population is quite high. As of 2019, the indigenous chicken constituted 94% of a total of 1.2 million chicken in the county. In terms of households, 65% of the households keep chicken, and the earning from poultry was estimated as 7 billion in 2020. However, despite these factors, the productivity is low at 30% against a potential of 70%. So why are these? What is the challenge in this place? And so despite the important potential that poultry plays in the livelihoods of women and youth, and even in the livelihoods of rural communities, there are several factors that have hindered their full potential to be able to contribute towards the effective or the maximum potential that it should provide. So it has also not been used effectively to deliver the economic empowerment that is envisaged. And research has shown several gaps. One of them is low knowledge and awareness on technologies such as vaccines, issues of access or distance of these technologies or the vaccines to the communities, issues of packaging of the vaccines in doses that are relevant and appropriate to the communities. And number 4, sociocultural issues in relation to livestock ownership, decision-making. So the key question that our project asked was, how do we address these gaps to improve women and youth and to improve the access and adoption of livestock vaccination technologies for improved agricultural technology, agricultural productivity, economic empowerment of women and youth, and improved food security? So that's the question that we sought to address, because we realize with the background that poultry has the potential of empowering and lifting up women and youth, but yet we are not seeing that happening in places where poultry is quite reared. So to address these issues, our project, the GIVE project, looked at the following objectives in Makueni County in Kenya. So one was to assess the level of vaccine knowledge among women, smallholders, and to study that linkage to their ability to use and benefit from vaccines. And number 2, to examine the sociocultural, economic, and technical barriers to access to NCD, that's the Newcastle disease, and contagious caprine pleuropneumonia vaccine in sheep and goats. And then number 3 was to examine the norms hindering women's participation and benefit from the livestock vaccine value chain and map actors who influence these norms. And lastly, we did an intervention to test a demand-driven model against a community vaccinator-driven model against the existing model, the status quo that exists in those counties, to be able to assess which one works best in terms of increasing adoption and uptake of poultry and goat vaccines. So what did we do? We developed an intervention that was to help us visualize, an intervention that was to help us achieve the goal of our project. And our goal was to see how we can push the woman who is at the down ladder, at the bottom part of the ladder, to see how we can work with her to move her up the solidarity ladder in terms of being more engaged in groups, and also the economic ladder in terms of just moving from keeping a few chicken to keeping more chicken, and also to keeping now more goats and sheep, because these are livestock which women have in this area able to own and to manage. So our intervention had different arms, but before the intervention, we did some studies. So we did a baseline survey to just be able to understand the status of the various variables we were interested in the community in terms of vaccination coverage, the number of chicken per household, whether the community, the members, the farmers belong to groups or not, among other variables that we were interested in. And we coupled this with focus group discussions to provide more in-depth information. We also did key informant interviews with various stakeholders and various key experts in the community. And we also did a WELI, Women Empowerment in Livestock Index, and did a baseline and an end line to be able to see whether our intervention was able to have any aspects of empowerment. As part of our methodologies, we also conducted training of the community in various aspects. So all the intervention entailed identifying specific members of the community and training them, equipping them with knowledge about vaccination, especially for the poultry. And we were calling them community vaccinators and peer educators, because they would go to the community, they would do the vaccinations, they would provide basic information, but in terms of more detailed information, they were linked up to the county veterinary officer to be able to provide more technical knowledge to the community. Besides that, we also helped form various cooperatives and also strengthened the existing groups that were existing in the community, with a view towards helping the smallholder farmers, especially the women and the youth, to take advantage of the power of collectives and the solidarity between them to be able to access vaccines and to be able to access markets. So what do our results show? Our results indicate we were able to vaccinate 257,000 chicken in a year, and we did this in 3 rounds. There was increase in Newcastle vaccine use at household level from 15 to 50%, reduced chicken mortality by 30%, and we also increased the number of women vaccinators in the community. By the time we were leaving, there were 26 out of 39 women vaccinators who are actively engaged in the process. We created opportunities for income for community vaccinators, mainly youth and women. And we helped to make the power to and power within for the women and the youth. We created stronger solidarity spaces where the women were able to take advantage of the power of collectives, even to access markets. There was increased participation of women in the vaccine supply chain. And overall, from the baseline to the end line, we were able to see that the Women's Empowerment Index improved from 0.9 to 0.95 end line. In terms of just empowering the women, also having the community vaccinators were able to get more confident and increased self-esteem as a result of the training we gave them and the ability for them to be able to go and interact with members of the community, vaccinate for them. And that helped also just to increase their self-esteem. So in terms of the data and evidence insights, we realized that triangulation of methods was useful in providing the full picture of the livestock vaccine situation in the study area. Our focus was on women empowerment, but we realized we needed to involve men from the beginning and throughout. So in all our data collection, the data that we collected, we involved men in those surveys and qualitative methodologies. We also had gender dialogues with the community, both men and women, to help facilitate the conscientization or the mind shifts, given that gender norms are quite entrenched in the community and changing gender norms is not easy. And so the gender dialogues were a process towards helping just the community be conscious about what exists and how that may impact negatively or positively in how they interact in the livestock space. The data we were able to bring, the evidence showed that we were able to move women into spaces that were traditionally male-dominated, and they were able to have power in togetherness to be able to make decisions as a group in terms of access to markets, in terms of access to vaccines, and they were able to overcome barriers due to middlemen in terms of selling of their products, and also to overcome structural barriers in terms of taking advantage of the power of numbers to be able to access vaccines, which ordinarily would require somebody to have a big number of chicken. But by taking advantage of the power of collectives, they were able to overcome these structural barriers. Thank you.
Thank you very much, Salome. It's really nice to see the WELI index changing there and going up. But also, as with all the projects so far, women feeling confident about moving into traditionally male-dominated areas really it sort of symbolizes that change in the social norms there. So as before, we will hold questions for Salome until after our next speaker, who is Dr. Hellen Amuguni, who's an associate professor at Tufts University in the Department of Infectious Disease and Global Health at the Cummings School of Veterinary Medicine. She holds a dual appointment at the Department of Public Health and Community Medicine. Dr. Amuguni has experience in infectious disease, gender, and One Health, and has been developing and implementing gender-inclusive and transformative assessment tools, trainings, and programs across multiple One Health and livestock projects. Working at the cutting edge of One Health, Dr. Amuguni integrates gender components into her work as part of her approach in strengthening collaboration and capacities of the sectors and actors involved in health service delivery. Over to you, Hellen.
Thank you, Joanna, and thank you for this opportunity. So my name is Hellen, and I'm representing the SheVax project. We are one of the 4 LVIF projects. We're working with Africa One Health University Network, University of Nairobi, Makerere University, and University of Rwanda. We've been implementing the SheVax project in 3 countries, Rwanda, Uganda, and Kenya, and our project is entitled Hearing Their Voices. It's an action research that supports women's agency and empowerment in livestock vaccine distribution, delivery, and use in Rwanda, Uganda, and Kenya. Why did we say hearing their voices? As a result of this, we really targeted making sure that the women smallholder farmers that we work with have a voice, they're able to tell their story, and they're able to reach policymakers and even researchers in different spaces. And so what I'm going to share with you are some of the tools that we actually use to make sure that we achieve this. We use the same tools as the other LVIF projects, key informant interviews, questionnaires, but I just wanted to single out the different tools that we really focused on to make sure that our project ends up being sustainable. Next slide, Joanna. We had 4 aims. One of them was to generate evidence and formulate strategies that position women to become effective and efficient and to contribute to the livestock vaccine value chain. We also wanted to enhance women's participation in livestock vaccine distribution, delivery, and use. And then as a result of this, we wanted to test these gender-focused models that target specific entry points for women along this vaccine value chain. And of course, provide data and information that can impact policymakers and programmatic changes. Next slide, please. So one of the tools that we used for our project in the 3 countries is outcome mapping. Outcome mapping is a participatory tool that is used to identify what we call critical stakeholders. We realized that to work with women smallholder farmers, it was not enough. We needed to be able to identify the allies. Who are the people that can work and support these women when our project ends? Government regulators, vaccine distributors, deliverers, livestock vaccine deliverers like veterinarians, agrovets, private agrovets, credit companies, all these different groups of people who we could build as allies around the women, men in the community leaders as well. And so we use this tool called outcome mapping, which is a structured participatory tool. It uses a bottoms-up collaborative process, and we engage critical stakeholders from the beginning. Why did we think this was important? We think if you engage these critical stakeholders from the beginning, you can be able to identify their incentives, you can be able to identify what it is that drives them, and you can be able to identify their outcomes. They can share with you the outcomes so that you align those with the outcomes you expect from the women smallholder farmers. Also, this allows them to ownership. They're able to be steered through this iterative process where they recognize their strengths and their limitations, and then their desired change. Where do they want to be at the end of the project? At the same time, we use this tool to map and track the critical stakeholders. As you can see in this map, this is the Newcastle disease vaccine value chain. Our stakeholders got together, all of them, the women, smallholder farmers, regulators, and then they mapped it out together as a team. And through this, they were able to identify missing links. For example, end users, women smallholder farmers, cannot access distributors. Regulators were not even talking to the women smallholder farmers. And so as they mapped this, they started a conversation among themselves, among each other, to be able to identify then how do we respond to these gaps. Next slide, please. We also used very different multiple tools that we called non-traditional. We used photo voice, which is, we called it PhotoVax, which is a tool where you provide women smallholders with cameras. So we trained a lot of women in the community to tell their stories using the camera. They were able to tell the story of their livestock. If their animals died, they were able to tell their gender stories. If there was any gender transformation that was going on in the community, they're able to tell their relationship stories with other livestock vaccine value chain actors. And then taking these stories together, we take those pictures, they had those pictures, use them in discussion groups. And then in the discussion groups, they would generate ideas, they would generate opportunities. They would say, this is where we want to go. This is what we see as the biggest problem. So we used photo voice as a really great tool. It empowered our women smallholder farmers. Many of them had never held a camera before. So this was an opportunity for them to actually hold a camera and tell their own story to policymakers. We then took these photo voice stories and put them into what we called a vaccine, which is a local magazine that we shared with policymakers and we shared with other people to listen to the women telling their stories. The other tool that we used is what we call a Vaxa calendar. So this is just a normal calendar that we made. We know everyone loves a calendar, putting a calendar in your house. Our community members, smallholder women farmers, many of them did not have calendars, but we used this as a tool for data collection, as well as a tool for collecting information from them and sharing information with them. We provided Vaxa calendars to a lot of community members, and what they did is they used it to document what was happening in their animals. So instead of us going and asking, when did you vaccinate? When did you have a meeting? When did you attend a training? They just tagged it on their calendar. You know, if they went for a training, if an animal died, they put it on their calendar. 6 months later, we can take a picture of that calendar and we know exactly what happened in their lives during that year. A lot of the women really enjoyed the Vaxa calendar. We also used it to provide information to them. So it had information on who can you talk to? Where are the veterinarians? Where do you access vaccines? How do you reach other women within your community? And so it was also used for that purpose. We found that women took this Vaxa calendar and were using it in their women groups to actually train other women. At the same time, we used tools like what we call jar voices and focus meals. So a focus meal is an adaptation from a focus group. We know focus group discussions, but for focus meals, we sort of used voices in transit. So in a sense, we'd go into a restaurant and buy community members a meal and then say, share with us your gender issues, share your information on who does what, decision-making, access to resources. We found that this captured what we call voices in transit. Usually FGDs are done. Okay, FGDs are done at the community level, and the regional like chiefs will be able to do that. But for us, we were able to capture these voices in transit. Next slide, please. And so as a result of this, we just wanted to share our outputs. We tested this women-centered livestock vaccine delivery model. We've trained 29 animal health service providers in the communities we worked with. We provided solar fridges because cold chain is a big thing. So providing solar fridges, which is a climate resilient, environmentally friendly tool. We've trained over 1,500 animal health service providers. And we provided vaccines over $20,000 for women smallholder farmers. Next slide, please. What have we seen since then? We've seen an improvement of over 80% in vaccine access in our communities. We know that at least 80% of the women in our communities are vaccinating their animals, 53% are vaccinating their goats. We've got a lot of animal health training that has taken place in the communities as well. We've seen an increase in access to animal health service providers. Next slide, please. What are the lessons that we've learned? One of the big things is that technical interventions need to be aligned with gender transformative interventions. In order to create a lasting model, we need to be able to link up any gender transformative, gender inequity, enhance those resources and access for women. We must be able to look at the structural barriers. We must be able to look at the constraining norms that underpin gender equality. Also, creating allies is very, very important for women. It's key to sustainability. At the same time, for you to be able to answer the whys, the hows, the wheres, and to empower people, you have to allow their voice to be heard. That's why we were saying hearing their voice. Let them be able to tell their story. So use the tools that allow them to do that. And then, of course, we've been able to build capacity for our teams. Building capacity for our teams is very, very important. We have to recognize the power of building gender champions within the community. And I think this is my last slide. Thank you very much.
Thank you very much, Hellen. It's really great to hear about the different methodologies that you use in SheVax to really try and bring the community's voices through. I'm going to open the floor for questions for Salome and Hellen. So if anyone has a question for either of our speakers, please raise your hand. Otherwise, Alessandra, is there anything that you've seen in the chat or that you would like to ask our speakers?
Thank you so much, Johanna. So there is one question. So first of all, Salome and Hellen, wonderful presentations. Thank you so much. There is a question in the chat by Joseph asking about thermostable vaccines and the benefits for women vaccinators. Now, if Hellen and Nargiza can answer this, okay. Otherwise, we can keep it for the plenary, because I do think that Peter, for example, would have a say on this. Hellen, Nargiza, can you answer a question about the benefits of thermostable vaccines for women vaccinators, or shall we keep it for the plenary?
Hey, Nargiza, let's keep it for the plenary.
I agree.
And then we can add some more information to that, yeah, because I think it's an important question, yeah.
Great, thank you so much. And then there is also a comment by Mahesh Chanda. Do you want to unmute yourself? And so I'm reading as we go through. In one of our project village, landless women poultry keepers have been trained in vaccinating their poultry birds. They don't wait for vaccinators to visit them and vaccinate birds. Trained in vaccinating has greatly helped them to be confident, independent, and empowered. We are working in this village and the CGI Impact Platform Her Plus project with IRI. Wonderful. I think it was a comment more than a question. Wonderful. Thank you so much, Mahesh Chander. I think we'll try and connect as well. We're also doing some work with her plants in Ilri, so wonderful. So, as you know, I am both a facilitator and actually a part of the Women React project. So I do have a question for ourselves. I think all four of us, all four projects have been working on gender norms. And I was wondering whether, you know, what are we understanding in terms of gender norms? Are these gender norms that I think all of us think are quite essential, affecting women's access to vaccines? Are there shared gender norms across the countries? Are they specific to context? You know, are there methodologies that work best? Basically, the question is, you know, what about meta-analysis of gender norms? What are other projects' feelings about this?
Is there any plan coming from SEBI Livestock? I mean, we are very, very interested in collating data and bringing data from different sources or disparate sources or different projects together to tell a kind of cohesive story. So actually, that was one of my questions as well. Is there a plan to bring the data together or bring the findings together from all four of the projects? Might be a bit much to ask each person in turn, but Hellen, you look like you're about to say something.
Yes, I can start with that. I think that was one of the main purposes of these four projects being funded with the same sort of goal and objectives in different countries. We were working across, I would say, maybe 6 to 8 different countries. And so it is important that we are able to take that data collectively and share what we have found. Already, the team has been working on one paper to be able to share different methodologies that we used and common methodologies that we used and what we found. And the question that Alessandra was talking about, are gender norms different, or issues across different countries that affect women? How does intersectionality affect different countries and different people in different places? What about culture? What about, you know, just different ethnic groups? How does that work? So we know that it's really, really important to be able to do that. And then usually gender data, a lot of people don't have like empowerment data. So like the Women Empowerment in Livestock Index is a key tool to being able to share that. A lot of research scientists are quantitative people, and bringing in the qualitative tools and ensuring that qualitative tools and quantitative tools actually are really, really important to be able to look at not just the data itself, the numbers, but also the whys, like I talked about, the wheres and the how across our projects. We would like to be able to do that. Yes.
Hellen, thank you so much. Wonderful. I think we can maybe also move this question to the plenary. I think maybe we can hear from Evelyn as well and so on, yeah? And then Annie.
Sorry, yes, I think the question I have is more for the plenary. So, and it also speaks to something in the chat. So if you don't mind, Alessandra, I should wait a bit.
Can I ask a question, actually, just leading on from Helen's comment? There is a big struggle with qualitative versus quantitative data, and there is a tendency, especially for animal health, the animal health profession, and speaking as a vet, you know, we really lean towards quantitative data and evidence. And so I actually had a question for Salome. In your presentation, you talked about triangulation of data to try and kind of verify or give strength to both sets of data. Can you just tell us a little bit about, for those who don't know what you're meant to do, what do you mean by triangulation, or what do you do, or what did you check with what else to sort of give yourself confidence that the qualitative data was accurate?
Yeah, thank you, Joanna, for that. And as I indicated, we used both a mixed method, looking at the qualitative and the quantitative aspects. So at the baseline level, when we started off our study, we did a questionnaire survey across the different study sites. But besides that, we also did qualitative interviews with key informants who helped to provide to back up the information that we were getting from the respondents. For example, when we're looking at the diseases that are prevalent in the livestock, for our case was CCPP and in NCD among poultry. So the community gave their perspectives, but we got validation from the key informant interviews about the situation of the disease in the community. In relation to aspects of empowerment, we had the WELI quantitative and the WELI qualitative. So the quantitative tool brought out some numbers which showed us aspects of empowerment. But how do we explain that empowerment? Because the numbers may not tell us the in-depth. So the WELI qualitative would help us open up the box to be able to understand what are these components if we're talking about women are more empowered in terms of being able to work together. How does that play out in a more qualitative perspectives by asking the farmers how they engage as groups and how that just helped strengthen their networks. So looking at all those aspects between the two different methodologies and seeing how they play out to either strengthen the information that is coming from one and providing more nuanced information about it. Thank you.
Thank you very much. And we will open up the discussion to all for all questions, all speakers. So if you have a question, please raise your hand. And I can see Annie, you've got your hand up there.
Thank you. Yes, so this is a plenary thing, and it also picks up on a point that was made in the chat about how can this platform increase collaboration among us. And I have a very strong personal interest in trying to be able to demonstrate the value of networks, because we're constantly challenged. Oh, why do you have a community of practice? Why do you have a network? What's the value in this? Why not just have a working group and produce an output? And I'm constantly fighting back against that and saying, actually, there is value in bringing people together, even if you don't know when you start why they're here. And so I wondered if the those of you who've spoken, or anyone else in the chat who is particularly involved in this area of work, have any thoughts about things that have come up for you from these presentations that show a sort of common thread about something where it might be really important to continue working together or to continue collaborating. And I know that is a very big question, but I would be really interested to hear initially just from the presenters, from your perspective, what are you seeing as the commonalities across the conversation that we're having here? Is there anything where it would actually be worth having another session in LD4D or communicating more among yourselves? So I will now shut up.
Maybe I can start just a little bit and then I'll leave. Just to mention one of the things that has come out of 4 cohorts is we work together to develop policy briefs. And these policy briefs we shared with our different partners. So in countries like Uganda, where University of Florida was working and SheVax was working, we did a policy brief together and brought different stakeholders, policy makers, private sector, to just sort of capture the key questions and comments and the recommendations from us. The same for Kenya. So all the countries developing these policy briefs that really target a particular group of people. I would say that was one of the benefits of working together, and it's something that we would want to continue, because we know that we do research so we can change lives, and policymakers have a lot of impact on that, play on that. Stop there.
I can also contribute to, sorry.
Yes, please go, Salome.
Yeah, just some of the learnings that also came out from this project, especially given the transdisciplinary, multidisciplinary nature of the projects. There was a lot of cross-learning from disciplines where you find the vets are coupled with social scientists, with economists. And so there was a lot of cross-learning. And I would just like to give an example from what stood out for me in our project. We had a vet who was working with us, and the vet had never looked at veterinary aspects from a gender perspective and didn't think that there was much about gender in livestock-related activities, especially livestock vaccination, until we went to the field together. And she was not quite keen on having the gender person there because she was like, this, we're just going to vaccinate goats. It's until she went and with the team, and when they were vaccinating, the women were not coming, people were not bringing the goats, and they were wondering, what is the problem? And so from the gender perspective, we were able to bring out the issues that the timing of the vaccination was at a time when most children are in school, and it's mainly the elder women who are staying at home. And for them, bringing the goats and adding them to the vaccination point is a challenge. And so that just opened her eyes, and she realized that there are a lot of things that sometimes we don't look at. And so just those cross-learning across disciplines was also quite a useful thing. Thank you.
Thanks, Salome. I wanted to ask Nargiza as well about the bringing intersectionality in it, not just with it looking at gender, but all the other things that disadvantage people that that stack up. Was that, I think intuitively people know that's there, but was that difficult to bring up and talk about with communities, because often it's not said out loud, the disadvantages that people face?
Yeah, it's bringing intersectionality into the discussion was actually very challenging. In the case of Nepal, the caste system has been banned and is criminalized. So if you discriminate, there are laws and policies in place. But when you go to the communities, it exists, it's ingrained. When we had initial conversations with the animal service providers, they would all say, okay, don't talk to me about caste. We don't have caste problems. Everybody's equal. But when you go to the communities, you will see that, no, it's not. It's the system is set up in a way that the people from the higher caste have better education, have better access to resources that leads to getting the jobs, for example, in the vet sector and so on. And then when they enter the communities of Dalits, they don't speak the language. They don't know, there are norms that are prescribed, how they can talk and how they interact. And yes, so that came out that was very obvious as we started the mapping exercise. And it took us a while to integrate intersectionality, and for our benefit, Jesse framework is already in existence, and we mobilized that to bring intersectional aspects and to facilitate discussions around the caste in Nepal. And I have to say that the animal health service providers were also very interested to make the change, because Nepal produces its own vaccination, and they produce big quantities. And vaccination campaigns happen every year, but they don't reach everybody. So they were interested to eradicate the inefficiencies in the system, to better understand why one group of livestock keepers are getting vaccines and the other one is not. So I think that personal motivation also one of the ways we mobilized that and used to work with them. In Uganda, the Karamoja is very diverse ethnically. A lot of the vets come from a particular ethnic groups or region, and may not necessarily speak the language and understand the culture and tradition of that of the group that they are interacting with. And here we mobilize the work of the community development officers with the vets or animal husbandry specialists to bring together and discuss and mobilize some of the tools that community development officer could bring into the intervention. So as some of my colleagues already discussed, one of the benefits of this project is that we were working together. We were constantly in communication and exchanging ideas. And I think learning, for example, from the SheVax, how they work with the stakeholders helped us to mobilize some of the stakeholders that we made a difference in our intervention.
Okay, thank you, Nargiza. I don't know if anyone from Rim and Ria want to just say anything on that. Otherwise, we might just move to Beth. You've got your hand up.
Oh, okay. Well, thank you. I just wanted to make a comment about the similarities. And I think especially in the 4 projects, one of the things we realized was that vaccine value chains are heavily dominated by government and government policy. And that it does focus on the technical side of vaccine delivery, quantitative, how many doses are delivered, very little focus on the people. And there was just for convenience, the household was accepted as the unit of outreach. And we heard, I think, from all 4 projects that it simply hadn't occurred to people to think that the household might be in any way dysfunctional or not efficient, and that men and women within the same household might not share resources and information. So that was really a big insight that needs to happen more regularly, but is rarely funded. Just making visible the barriers for all of the disadvantaged people so that it can be discussed and addressed. We also found that government often assumes empowerment means women earning money, but the decision-making was often not considered. And that also was very eye-opening. But again, livestock departments tend to be vastly underfunded compared to other departments, even in agriculture. And if they have to pay for their own gender training without having had any to know why it matters, as Salome had mentioned with the vet, it's very difficult to get it on the agenda. Thank you.
Thank you, Beth. We've got time for one very short comment or question, if anyone has any. Otherwise, oh, yep, Catherine, I can see your hand up.
Thank you. Maybe following on from Beth's points there, I'm kind of interested in what the scalable elements of this work are. These projects seem to work with a lot of, context-specific, intensive support and input at multiple levels in a system. And so my question is really, how do we take gender-inclusive vaccine delivery to scale, and what works across multiple contexts? What are there some of those common elements, that maybe we can bring into these, diverse contexts, or does this always need to be very specifically designed for a specific context, a specific country, etc.? Thank you.
Thanks, Catherine. Great question. Any, Alessandra?
Yeah, I think Agnes would like to answer.
Sure.
Yeah, so for our team, part of how we have been answering this has been how we package the lessons. So we have worked in community A, community B, but what are the key lessons in terms of what's the process, what are the skills that vets officers need to have so they are able to better pay attention to the gender issues. So we have been working on documenting these as best practices that can be integrated in the training that goes out to vet officers. The other angle is also around the technology. So what data are we collecting so that we are able to better highlight the needs of women, that we are able to target women, and so through the platform that we have, Cowtribe has been using on this project. We are also working with government to adopt this as the data entry system for how they run vessels. So that's already from the start, when they are collecting data on who is the farmer. The woman is recognized as the farmer. When they are vaccinating, they know which farmer they are reaching with which vaccines. Over.
Thank you very much. Unfortunately, we're out of time, and so I'm going to have to bring this discussion to a close. But I'd like to I've put into the chat the link to our community hub. There was a question about how we continue these conversations. The hub is a relatively new entity. We've just designed it earlier, just 2 months ago. And we really would like to see people use it more to reach out to each other. It was designed as a request from our COP members. And so please do join up. Please do ask each other questions, and please do check it regularly. So thank you so much to all of our great speakers today, and for everyone who attended, and for taking the time to share these discussions, share data and evidence generated by the projects, as this all contributes to our knowledge base about the role of gender and intersectionality in improving livestock health service provision, livestock service provision and health, sorry. Thank you very much to everyone, and hope to see you again soon. Thank you. Bye.
Bye, everybody.